Hello there, and welcome to Dry Eye Girlfriend, the podcast where beauty, wellness, and science come together in the most eye-opening way. I'm Angela, your advocate, wellness enthusiast, and go-to girlfriend for all things dry eye. Sure, there's plenty of science and medical jargon out there, but where is the real talk? I created this show to raise awareness, share practical solutions, and bring you episodes with global experts, holistic health pros, industry insiders, and women just like you who are navigating the same journey. We talk about everything from nutrition and skincare to the most up-to-date science in dry eye. Because when we start connecting the dots between lifestyle and eye health, everything starts to get a whole lot clearer. Let's get into it. All right, we made this happen. Finally, I know we've been talking about this for a while.
Yeah.
And here we are. So the idea behind this one is I just wanted to do a podcast, Dry Eye 101, we're calling it. And I thought of you. I've already kind of, gave you a bit of a background, but I thought of you as, from an expert perspective, you're my go-to. Every time I think about dry eye or have a question, I always think of you. So Dr. Maharaj is on our show, and I'm so excited to have you. Before we get started, can you just tell us a little bit about yourself, and then we'll dive into Dry Eye 101?
Sure. Yeah. No, thanks, Angela, for having me. And I'm honored to be on this. This is wonderful. I'm glad to see us having these conversations. It's exciting. Yeah, you and I have known each other for a long time, but for everyone else, I'm the managing partner of Prism Optometry Services at the Prism Eye Institute, and I'm the director of the interventional dry eye program there, and have been doing so for the last 3 years. Prior to that, I owned and operated a private clinic as well, Eye Labs, which was another dry eye center. Besides that, I'm an associate faculty at the University of Waterloo, and I do some work, some consulting work with various, industry partners in the dry eye space. I teach. I run a conference as well for other physicians and practitioners in the dry space. So I dabble in a lot of different things, but most important to me is being a clinician, being a dry eye specialist that helps patients day in, day out.
No, that's amazing. And I know, you just glossed over it, but you're the founder, one of the founders of the Dry Eye Summit, which is it's a huge program. It's a national Canadian program that brings together those doctors that are looking to learn more and more about dry eye. And I've seen it grow exponentially over the years, which is great because then there's more and more opportunities for care for patients, which hasn't been there in the past. So that's exciting. Anyway,
Yeah,
let's.
it was a fun journey to kind of get it off the ground. When we started, our first year we had less than 50 docs in attendance, and we grew that, myself and my two other partners, Dr. Jeff Goodhue and Dr. Trevor Miranda, into what it is today, which is the largest, Canadian conference that's dedicated to dry eye. And yeah, it's been a great journey to see other practitioners across the country kind of really rise to the occasion. And looking at this now, almost 8 years later from having started it,
Mhm.
there's a huge presence and fortunately a large number of opportunities for patients to seek out and obtain care across the country. So it's been fantastic to see how it's evolved over this last little while.
Yeah. You know what else I noticed? I attended this year, and there's a whole section now for eye hygienists, which, we're kind of getting off topic, but I don't know if a lot of people know that there is such a thing and, what that would look like. I think of, the dental kind of structure, and this is that, right? From a dry eye perspective or an eye health perspective.
Very much so. What
Hmm.
became very obvious early on, from when I was doing it, when I started managing and bringing dry eye services and treating dry eye in a dedicated manner, it was me. It was really just me and me alone. I had my staff obviously supporting the front desk, but it was really me. What became very obvious soon after, though, was knowing that it was very, very helpful to have one of my sort of key technicians or key assistants assist me to not only be more efficient, but it gave me more time with, if it were you or anybody, it would give me more time with the patient to sit down, to listen, to hear what was going
Mhm.
on, so that I wasn't having to be distracted by, okay, well, what do I have to do next? I have to prep this patient for the procedure, et cetera, et cetera. So we brought on ocular hygienists, and we tied that into our education at the conference. And
Mhm.
yeah, now we train hygienists from, again, across the country, and that program within the Dry Summit has actually been the largest growth. So we see those very much in tandem with, a dental hygienist who's an educator as well as
Yeah.
a hands-on patient care provider. So yeah, it's changing.
That's really cool because I don't think a lot of people know, right? Like if you talk to anytime that I'm talking to my girlfriends about dry eye, and that's really what we can dive into too right now, but a lot of them don't know what is available and things like that are available. So,
Yeah.
without further ado, from a dry eye definition perspective, it's evolved over the years. How would you define it now? Like when you are asked the question, like, what is dry eye?
Yeah, in the chair, when I say this to a patient, I've always found the term dry eye to be a bit of a misnomer, because
Hmm.
most times patients are complaining that their eyes are watery. How could they be dry? It
Right.
almost seems counterintuitive. But essentially, what it is it's a dysfunction of the fluid that coats the eye, in very
Hmm.
simple terms, right? And so we've experienced symptoms of, the eyes feeling itchy, or the eyes burning, or even maybe even getting red. We kind of think of our tears as just being water. But the reality
Hmm.
is, it's actually a very complex solution, very much like our blood is to our body. Our blood is really complex, and it allows us to heal, it allows us to fight off infection and disease. Our tears do the exact same things for our eyes. It's just acellular. There's no cells in our tears. That's why we can see through them. If there were cells, we'd have a hard time seeing the world. So without the
Right.
cells, we still have these wonderful, exquisite chemicals that protect our eyes, that nurture our cornea, which needs to be clear so we can see the world clearly, which prevents infection from setting in from invaders around us, which prevents allergy from setting in most cases. So it's a really important liquid and solution that gets secreted by all the cells around the eyes, by all the cells in the eyelids,
Hmm.
and it's controlled and regulated by our brain. Our brain actually is doing a lot of this control, and then our brain kind of uses our hormones and our nerve endings to orchestrate this exquisite balance that is eventually achieved on the surface, so that the eye, in its healthiest state, isn't running over with water, isn't beet red and sort of screaming at you that I'm angry. It's just a little bit glossy, it's very clear, and
Hmm.
it's doing this amazing job at all times. It's what I call organized chaos.
Hmm.
So if you think about it that way, it doesn't take much to throw that chaos off balance.
Hmm.
And when it does get off balance, it in a healthy eye, that balance is soon restored. But when the tear film is dysregulated, when it's not working properly, that return to normal, that balance doesn't get established or reestablished after it's been disturbed. And that can spiral, and it just depends on the severity and the causes. But that's really it in a nutshell, and how I like to kind of talk about it to both patients and practitioners alike.
Hmm. Hmm. And that's a beautiful way to put it all together. It's not just an eye thing. It's an orchestration of your hormones and everything else, because it's so complex. And I think that that's what a lot of people don't understand. From it's a pesky, my eyes are watering scenario, but when you think about it the way you described it, it is so complex. If you broke it down, I always like to think of it this way. There's three layers of the tear film. Can you describe what they are? I know you went into kind of a broader overview of that, but describe what they are and the functions of each. I think that would be.
Sure, yeah. Yeah, no, I think the components, when you break it down, you get to the nitty-gritty. There's oil,
Mhm.
there's water, and there are proteins. And proteins really kind of take the form of mucus, right? We've all had boogers, right? We all
Yeah.
have kids that have that runny nose when they're sick, and it
Yeah.
just comes out for days. Well, it turns out that when it doesn't look like that, it's actually part of our tears.
Oh,
So we
wow.
have mucin or proteins, we have water, which makes up the bulk of the tear,
Mhm.
and then the oily layer. And the oil is secreted from the eyelids, the upper and the lower eyelids. So every time we blink,
Mm-hmm.
there are these little gland-like structures that secrete and squeeze oil to the surface.
Mm-hmm.
The water comes from a little gland that sits behind the bony part of the eye. It's also secreted by some of the cells on the eye,
Mm-hmm.
and that gives you the bulk of the tear. And then the proteins or the mucus that I discussed, those are also secreted by many cells in and around the eye. They all mix, they all get spread over by the eyelid, and that coats the surface. And once the tear has sort of done its job, it's constantly cycling through, it exits through these two tiny little holes in the corners of our eye, and it exits into the back of the nose, the back of the throat, and then it dissipates. So in a perfect world, we're producing a tear and we're draining tear all at the same time, and it's happening constantly and being regulated constantly.
Mm-hmm. No, that's great. And when it comes to dry eye itself, um, is there a sort of from a oil-based production standpoint and from like an aqueous-based production standpoint, different types of dry eye, basically?
Yes, absolutely. So when a patient, the majority of patients, so if we look at 100 dry eye patients or
Mm-hmm.
100% of patients, the majority, about 9/10 of them, are going to have, statistically speaking, we see this, are going to have a problem with their oil production and or oil secretion. So we call these glands in the eyelids meibomian glands. Meibomian gland
Mm-hmm.
dysfunction is the leading contributor to dry eye or for dry eye. And so oil tends to be the leading component that is dysfunctional. That being said, there's still a significant component of patients that may have an additional problem with their water layer, or we call that aqueous deficient dry eye. So the vast
Mm-hmm.
majority are oil deficient or what we call evaporative, but there is a contingency of an overlapping contingency of little less than half that may have an aqueous component, or 50% or less that have an aqueous component. And so we see a lot of the oil dysfunction in contact lens wearers, in makeup wearers. We see this more so in females than in males for sure. Our aqueous deficient
Mm-hmm.
patients, or patients that have low water, we do see a high correlation in patients that have autoimmune diseases, for example. There's one in particular
Mm-hmm.
called Sjogren's syndrome, which is, essentially, it's really a common, unfortunate, common condition to see severe dry eye disease in. So, um, yeah, so a lot of times the cause helps us to know where to look a little bit deeper, and maybe even getting the your family doctor involved, for example, to test for
Mm-hmm.
these autoimmune conditions or to see what might be contributing to the oil glands being dysfunctional, because there can also be autoimmune components there as well.
No, that's interesting. And I've always said like the eyes are kind of that window to a lot of what could be happening in your systemic health, right? And we've talked about that before too. What I also wanted to chat with you about are these are different types of dry eye, but are there other eye conditions that mimic dry eye or, potentially could coexist with dry eye? Things like blepharitis or ocular rosacea or Demodex. Can you dive into those a little bit for our
Oh
audience?
yeah,
'Cause I don't know if they
yeah.
know.
There are a lot of masqueraders. There are a lot of co-conspirators, so to speak.
Yes.
And as you would imagine, dry eye disease doesn't live in a silo. It's very much interacting with the rest of the eye. So, we'll start at the kind of the easiest one to pick on, which is allergy. Allergy shows up and really mimics. It's the great masquerader for dry eye. The two tend to coexist in a lot of cases, but it turns out that when we take an oral antihistamine like a Claritin or a Reactin, those are great at calming down our symptoms of allergy. But the actual antihistamine itself, the oral antihistamine, can also dry out our mucous membranes like our mouth, our nose, and our eyes. So a lot of times the medicine for the allergy can
Mhm.
also affect the eyes negatively. So that's one thing. You talked about blepharitis. You talked about Demodex. Absolutely. In fact, um, patients that have these lid diseases, so blepharitis is essentially inflammation of the eyelid margin, and it can be bacterial in nature, it can be parasitic, it can be mixed. But when there is that sort of
Mhm.
debris and biofilm that builds up on the eyelid margin, that forms blepharitis, and that can inevitably affect the gland health, the lid health, and it can cause chronic inflammation, which breaks down the tissues. More specifically, the parasitic
Mm-hmm.
type of blepharitis is known as Demodex, and Demodex is an ugly little critter that sits in our eyelash follicles and even in the meibomian gland or oil orifice. And these little bugs, you can't physically see them with the naked eye, but under a microscope, we can see evidence of them. And they can wreak havoc on the eyelid margin, on the gland structure, on the degree of clarity and viscosity of the oils that we produce. So we now know that Demodex is found in a high proportion of patients that have rosacea, ocular rosacea, which you touched on. And
Mm-hmm.
rosacea is a skin condition. We always think, oh, rosacea, Santa Claus is a great rosacea patient, got nice rosy cheeks.
Yes.
But rosacea can also show up in the eyes, in the eyelids, and with rosacea and Demodex, those two are like white and rice. They go together, and
Mm-hmm.
they really create some major problems for the glands and for the oils. So it's not. They definitely don't exist in isolation of each other.
And so when you have all of this going on and you're trying to diagnose what's happening, what are the, like, how would you tackle something like blepharitis if that's somewhat of a co-conspirator and you need to get that under control? What does that look like from a treatment perspective?
Yeah, you know what? You touched on a good point is how do we actually get to the diagnosis? I mean,
Mm-hmm.
without jumping too deep into that, that is the most important thing is to determine what is the root cause. And a lot of patients that suffer in silence or even suffer in the process of receiving their care, they often think, "Oh, well, why is my doctor not just giving me a drop to fix this all?" Or, why am I still dealing with this? And it often is because we need to know what the cause is. What is your condition attributed to? Is it the oils? Is it the water? Is it blepharitis that is poorly controlled? And if it is blepharitis, is it bacterial? Is it parasitic? Is it mixed? And so, if in fact there is what I determine to be eyelid disease or lid margin disease, that's
Mm-hmm.
akin to gum disease, if you will, or gingivitis, right?
Mm-hmm.
So we know about our oral health. We know we have to brush, we have to floss, we have to make sure that we're taking care of our oral hygiene. Well, the same rules apply to the ocular surface. So I will generally say if a
Mm-hmm.
patient is not already using an eyelid scrub or a wipe, usually it's a non-preserved antiseptic wipe, whether it has hyperchlorous acid, which is a common, very calming antiseptic, a natural antiseptic, which helps to resolve and reduce that bacterial buildup. The environment that is nurturing to these Demodex bugs, we want to wipe those bacterial bugs away.
Mm-hmm.
Sometimes we'll use a tea tree oil based cleanser that is very, very harsh for Demodex to survive in. And so using a lid hygiene uh, wipe or product of some sort, so important, especially if you're wearing makeup as well. And I certainly don't you know punish people for wearing makeup. In fact, I encourage it if that's your desire. But
Mm-hmm.
with that comes an environment that is just perfect for bugs to live in and to thrive in and to kind of wreak havoc. So really important to make sure you're removing all of that with either a micellar wipe. I love micellar water for this, just to remove the physical debris,
Mm-hmm.
and then an antiseptic cleanser on that area to kind of keep the bacterial burden down.
I love that advice. I just got some micellar wipes, and I usually always use the tea tree oil pads, the lid and lash ones. So I have that when I'm doing well, when I'm actually being compliant. But that's really helpful, and I think you touched on a
Yeah.
lot of things when it comes to dry eye and treating it. So I wanted to get your opinion around. We talked a little bit about makeup, but when it comes to dry eye, and I think a lot of people listening may not know they have it or they suspect they have it, but they're not sure. Who is at higher risk of developing or having dry eye? Is there, you know, anything that comes to mind when you're like, I would definitely, go to an eye doctor, not just to get glasses, but to maybe get your dry eye checked.
Yeah, I mean, look, top of the list is going to be if I'm putting an archetype, top of the list is going to be a female over the age of 50, right? So right there you have two
Hmm.
factors that are completely outside of your control, but those are two factors that put you at a high risk for having and or developing dry eye. Over the age of 50, there is an impact on hormonal shifts, which again directly regulate oil production, oil secretion, not just in your eyes, but in the rest of your body. So that's certainly a risk factor. Um, and again, we talked about cosmetics.
Hmm.
Cosmetics are a contributor. Other patients that are at risk, though, other
Hmm.
sort of flags that I look for, contact lens wearers, that's a big one. Patients that have undergone refractive surgery of any kind,
Hmm.
whether that's LASIK or even refractive IOLs. Um, Patients that are, or people that have been diagnosed and are taking medicine for their glaucoma, they're at high risk because the medicine for the glaucoma, although it's helping to
Okay.
prevent them from going blind, and that's important, the medicine in and of itself is actually quite harsh on the
Hmm.
surface, and so they're at high risk for it. Um, and then again, like I mentioned earlier, patients that have a
Hmm.
history of autoimmune conditions, diabetes, for example, and patients with thyroid disorders.
Hmm.
So those are the kind of hot buttons that I look for if I'm seeing a patient for the first time and my assistants are taking information. Those are if I see any of those, I'm usually my spidey senses start to tingle and I'm looking for clinical signs of that.
Yeah. No, that's super helpful. And I think that's a lot of people listening, to be honest. So
Yeah.
I also find a lot of people are telling me, well, I don't go to an eye doctor because I don't need glasses, right? So this, should get you thinking, go and see an eye doctor for potentially having dry eye. And we did touch on some of the symptoms, but what are the other classic kind of symptoms of dry eye that people may or may not be thinking could be dry eye? So watery eyes being.
Yeah, no, you hit it, right? So watery eye is the classic one that kind of gets mislabeled because watery cannot be dry. It's paradoxical, but it's actually true. A
Hmm.
watery eye is very much or can be very much a dry eye. Um, Itchy, again, we
Hmm.
often associate itchy with allergy, but itchy or burning eyes, certainly. Light sensitivity is one. So you may find as we're recording this right now, you may see me kind of doing this once in a while. And that, yeah,
Me
right.
too.
And that pursing of the eyelids can sometimes actually cause additional friction. But light sensitivity is
Mm.
one. But here's one that people most often miss and do not associate, and that's blurry vision, right? So intermittent
Mm.
or unstable vision that either changes with a blink, it either gets better with a blink, or it gets worse with a blink. You can almost think about your eyelids as they
Hmm.
blink over. You can almost think about that as like your windshield wipers of your car. And if you have low fluid in
Totally.
your windshield wipers and you put those wipers on and there's sleet and snow on the road, that's just going to smear things across and your vision's going to be blurry. But then you get that one
Mm.
good pass and everything clears up. That's basically
Yeah.
what happens. And we in the dry eye world, in the clinical world, we call this a vision disease because it very much is
Mm.
a disease of the visual system, but it shows up that way. It's intermittent, changes when you blink. That's a key one that people often don't associate. They think they need new glasses, and as you said, they might think about going to their doctor to get their glasses checked, but that in fact may be one of the first signs of dry eye disease developing.
I'm so glad you mentioned that because I was talking to someone about dry eye girlfriend. They're like, what is that? So I started explaining dry eye, and I said, the way that I knew, or one of my symptoms, is actually when I'm driving at night and I notice my vision's fluctuating. And she turns to me and she's like, huh. I have fluctuating vision, not just at night, but often. So, this is again, like you were saying, another symptom that may not be recognized as dry eye. And I feel like there's so many people walking around with dry eye that don't know it. What would be your guess um, for the amount of people that are undiagnosed with dry eye?
Undiagnosed. That is a great question. Well, we know that statistically speaking, 1 in 3 adults actually have, or 1 in 3 adult Canadians. I can speak to Canadian numbers, and that number in North America is around 1 in 5, depending on the study that you look at. But 1 in 5 patients in North America, 1 in 3 in Canada, have dry eye disease. Uh, and so,
Wow.
just, if we just talk about this, as I've spoken to colleagues across the country, I guarantee that we are not diagnosing 33% of our patients as having this condition. And it's definitely much lower than that. So if I were to hazard a guess, I'd say that we're probably hitting maybe 25% of patients that actually have it are being diagnosed. So we're missing a good number. There are a lot of patients that
Wow.
are undiagnosed. The other thing too is that there's a new wave of dry eye that is showing up and that's emerging and going into offices, and that's with our younger cohort of patients. And by younger, I'm dating myself here, but younger I mean our teens and our 20s and even our 30-year-olds who are having increasing amounts of screen time. They're getting on screens at a much earlier age than I certainly did. And so their lifetime, if you look at their lifetime of screen time and the impact that may have, I think that we're actually at a precipice of, this sort of tsunami-like incidence of dry eye. And I don't think it's going to be the type of dry eye that we've seen classically. I think it's going to be very insidious because at a younger age, the clinical signs aren't very obvious. And in fact, we get used to just being on a screen and thinking, oh, well, I've been on a screen all day, so my eyes are going to be uncomfortable. But these symptoms may actually fly under the radar for many years before it even gets brought up to a doctor. So that's something just to kind of keep your eyes open. If you have family or friends that are younger, that are in an office or just on their phones all the time, making sure they get their eyes checked regularly.
Gaming.
Yeah, you and I.
Oh yeah, it's huge. It's huge. Gaming is huge. I've talked to my girlfriends about this too, and I've said exactly what you said. I think that there's this new wave of dry eye that it's going to be the norm when it comes to our youth because of the way they were raised on screens, right? So these are important conversations to be having for
Hmm.
sure. That's for sure. So um, we've talked a lot about dry eye, diagnosis, the type of people. When it comes to treatment and what actually works, what is sort of the pillar of treatments that you would use? I know it's probably dependent on the type of dry eye, but you know, I'm thinking, someone comes in and you create a plan for something very basic. But what are the other treatment options that are available to people that they may not know
Yeah,
about?
that's a great question. So yeah, you're right. There's varying degrees of severity, but once you're in this sort of chronic state of the disease, which the brunt of dry sufferers are, this is where a combination
Hmm.
of at-home therapy and in-office therapy start to apply. And some of the work that we do in the clinic
Hmm.
on patients involves using procedures like intense pulse light, for example, or IPL, as it's known. And some people might be familiar with IPL as a form of hair removal. It's commonly used in dermatology for hair removal and facial rejuvenation. But IPL is actually used on the eyelids to stimulate those meibomian glands, to thin out those oils, to clear up the bacteria and the Demodex that are on the surface. So evidence is really, really strong in supporting its efficacy in treating meibomian gland disease and restoring the tear film. There's other techniques like
Hmm.
radiofrequency, which again used in dermatology and skincare to tighten fine lines and wrinkles. But for the exact same reasons, it also helps to reduce the clogging of these pores of these glands in the eyelids. Um, there are also pharmaceutical drops, right? So we talked about how this disease of the tears is basically an inflammatory state. So we need to calm that
Hmm.
inflammation down. So there are very many times where we're going to have to reach for, a pharmaceutical, a drug. That's an eye drop. That kind of tamps down that inflammation. And while we're tamping down that inflammation,
Hmm.
we're also working on the glands in the office at the same time. So it's not uncommon for a
Hmm.
patient to be on a drop, a prescription drop, a scrub, and then I'm also doing, or my colleagues are doing, a procedure to get those oils unclogged to really rehabilitate the surface, the tissues, and get things under control. We even use, if you could imagine this, I don't know how this sounds, but sometimes we'll use amniotic membrane. Amnion is the tissue that surrounds a baby when it's in utero. Well, we use dehydrated
Hmm.
discs of amnion that are the size of a contact lens that we put on the cornea to basically kind of put that inflammatory fire out. And then in
Mm.
even more cases, we also start to use drops that are made from your blood, right? Like autologous serum is one version, or PRP, which many people have probably heard being used in dermatology and skincare, but we also use it on
Yeah.
eyes. So as you can see, I mean, the host of options of what we use are huge and immense, which again goes back to just
Hmm.
understanding really what's the cause here, so that we're not just throwing the kitchen sink at every patient. We really want to have, a very succinct and customized approach. That's really important.
Yeah. No, I agree. I agree. And there are, even over the last 10 years since we've known each other, there have been so many amazing, innovative therapies that have come to light. I think early days it was Restasis. That's who I was the rep for. And that was really it. You did touch on home care and what that looks like. What are the things that people can do from even a prevention standpoint? Just starting to think ocular surface, maybe I should be paying attention to this, like brushing my teeth. What are the things that people can be doing to start preventing sort of going down this road of developing dry eye?
You, that is, I wish every patient would ask me that question. Because if we started talking about that first, you may not even go down this path. You're right. Okay, so
Right.
the basic things are sleep quality, right? So sleep quality is huge. Sleep is when your eyes
Yeah.
will recover and rejuvenate for the next day. Hydration, right? Are you drinking your water? Are you getting
Mhm.
enough hydration through your body? Your cells hydrate. Your cells are part of your body. Your body's part of your cells. It's interesting.
Mhm.
We sometimes think that these are somehow separate from the rest of our body, but it's all part and parcel. So hydration.
Exactly.
Um, uh, uh, Another one that it may not be obvious, but having mental clarity, right? So mindfulness,
Mm.
right? So several studies have actually drawn parallels and even tied together the incidence of anxiety and depression as it relates to having dry eye. In fact, there's a significant increase in correlation between anxiety, depression, and dry eye. And so I'm constantly reminding my patients to make sure you're practicing mindfulness, whether that's breath work, whether that's meditation, however you decide to do it, but trying to really find that center in addition to the sleep quality and hydration. The last thing, which perhaps it should be the first thing, is our good friend Laura Perriman talks about pharmacy, Pharmacy. So what you put into your body,
Mhm.
right? So what you
Yeah.
eat, that absolutely has an impact on your gut health, has an impact on your mental health, and we know that there's
Yeah.
actually an axis. It affects your ocular health. So what you put into your body inevitably affects, the ocular health, not just the inside of the eye, but as we're talking about it today, the tears, the glands, the nervous system that supports that whole structure. So what we put in inevitably affects how it comes out. So food, sleep, hydration, mental health. Those are my sort of four major pillars.
I love that. I love that so much because I don't think a lot of people are making that connection. And it is one of the most important connections from a prevention standpoint and just overall good health standpoint, right? So I know there's a movement, but it's nice to see that this is also part of the dry eye story too. So that's well said. And I do appreciate that. And, I couldn't not have a conversation with you without bringing up kind of the future and what that looks like. I know you're very innovative and you're always looking at, what's happening and you're part of bringing amazing technologies and different modalities to the space. So is there anything that, in your travels of late that you're super excited about that's coming down the pipeline from a dry eye, either treatment perspective or just conversation perspective?
There's a ton of great new therapeutics emerging south of the border. As everybody may or may not know, we're in Canada. So the Canadian
Mhm.
landscape generally hinges on the US landscape. And so the US landscape has had, in the last, 4 or 5 years, has had several drugs emerge that are novel. So there are drugs that specifically target the lipid layer only. There's a nasal spray called Tyrvaya that that stimulates the nerves in our nose, that stimulates tear production. There is a new drug that just got approved recently, this within the last few months, that targets the pain receptors on the eye. And as anybody that has a advanced form of this condition, it could be very painful. So having a pain related medicine to help to address the neurosensory component is completely novel, which is very, very exciting. In Canada, we are using now we've been testing and working with it at Prism, something called the jet plasma pen. So again, the jet plasma pen helps to ameliorate and work on meibomian gland dysfunction in a novel way. And so we have devices that we can use. We have new drugs that are emerging. We have science that has been telling us that we need to keep looking further and further in this area. But it's wonderful to have these therapeutic options showing up stateside. There is a little bit of a delay getting it into Canada for multiple reasons, both bureaucratic and just financially. But we're a patient bunch here in Canada, and I think if we're continuing to be patient, we'll eventually get it. But it is exciting. It's exciting to see this kind of innovation. In fact, the dry eye, for everybody that's listening here that's outside of the clinical landscape, the dry eye landscape is probably the fastest growing aspect of of eye care, right? And so there's a lot of innovation happening in this space compared to any other disease space, whether that's glaucoma, retina, dry eye is really kind of getting a lot of the attention right now, as it well should. So it's exciting. I think the next 5 to 10 years are going to be a real sort of game changer. I don't like to use trite phrases, but I do think that this will be a very exciting next 5 years, and for sure.
I thought for sure you were going to use a Star Wars New Frontier.
Oh,
Oh,
you almost had me there.
but
Yeah.
no, I love that. I love that. You did mention something, and I think this is really important. So, yes, people feel the pain of dry eye, but there's another type of dry eye that they don't feel anything at all. There's no, like, it's asymptomatic almost. And to me, that's the most important dry eye to get in to see, because my gut feeling is those nerves have been destroyed and now they no longer function to tell you there's pain. And I feel like half of my friends are those people because I look at the way they wear makeup, I look at all the things we just talked about, and I'm like, maybe go see an eye doctor just to make sure.
Yeah, you're right. So we call that neurotrophic keratitis or neurotrophic dry eye, and so that is when the nerve endings on the eye become basically silent, right? They turn the signal of pain or discomfort off, and that can happen for a few reasons. For example, if you've ever had shingles or if you had Bell's palsy, that's an obvious reason that the sensitivity goes down. But it can develop in patients that are diabetic. It can develop in patients that have had surgery. It could develop for patients that are chronically either overusing their contact lenses and or poorly taking care of their cosmetics. Basically, if you constantly damage the eye and irritate the eye, eventually the brain is going to shut that system off and say, no more, I don't want to feel this. And that may make you feel perfectly fine. But if under a microscope it's looked at, you're going to see that cornea, that surface, is no longer healing and repairing itself. And it's a very, very dangerous set of circumstances if not caught early enough. We're studying right now at Prism, we're doing a little study using insulin to treat these patients topically on the eye. And so all that said, the symptom, as I talked about earlier, because you're not going to feel it, the only symptom that you may have is blurry vision. And again, a lot of people, if it's just one eye, you have the other eye that's compensating, you may not even notice it. And so all the more reason, as you said at the very beginning, you hit the nail on the head, we have to make sure that we're having annual eye checkups to not only assess for disease inside the eye, but the surface of the eye, your vision, because this is where these types of silent conditions get caught. And when caught early, the prognosis is great. But if we catch it too late, we're often just trying to chase our tails to try to slow it down if we can, or at least hold it where it is. But there are some cases where we really can't turn back time, and it's hard on you, the patient. It's hard on us, the docs. Like, it's not a pleasant set of circumstances. So get in early to see your doc and and make sure you're getting that surface checked out.
And that's a really good point because I also find, you know, people may not understand, okay, yes, I have dry eye, but what's the why? Like, why should they care to treat it, right? Like, how bad can it get? What does happen if, this blurry vision or these watering eyes just keep, being a nuisance, but I'm not doing anything about it? What is the actual, like, risk now involved that, dry eye doesn't even sound like a disease, but leads to something pretty unfortunate?
You know, Angela, that's a great question. It's a great comment. In fact, it deserves its own episode, really. It's, what does it take to move us as humans to do something, right? So, if you're a smoker, what does it take to get a person who smokes to stop? We know
Mhm.
the consequences of smoking. It's well established in the literature, yet, if you're on it, you're going to continue to do it. What keeps us on scrolling on our phones, doomsday scrolling, as they say?
Yeah,
We know
yeah.
that it's rotting our brain and affecting us. It's dopamine, right? It's that dopamine hit. And so the question whether or not, or what's it going to take for us to take dry eye disease or ocular surface disease seriously,
Mhm.
I think it shouldn't be this sort of bar of, oh my goodness, what could go wrong at the very tail end of it is what small things do I do every day to ensure that I am optimized in my health? And that is, like I said, the four things: eating right, hydrating, sleeping, and mental health. But then if we were to say,
Mhm.
okay, I'm doing those things, what else can I do? Well, then it's annual eye care, right? It's every year get yourself checked out, right? It's just
Mhm.
these small little things that add up over time. I think that's achievable, right? If we can break down, um, I say this to my patients, every complex problem is a series of simple solutions just stacked together. And so you just have to find what's the smallest step that you can take. My daughter was she's old enough now that it's not her favorite anymore, but Frozen, right? Frozen, every little girl
Mhm.
loved Frozen, and Frozen
Yeah.
2, we went and saw that, and there's that song, just do the next right thing, right? Just take a
Mhm.
step, take another. What's the smallest step that you have to take to get to the next right step? I think
Mhm.
that's where we should focus our energy, in terms of taking care of the surface, in terms of taking care of our health and our bodies. It's just doing the next right thing and breaking it down so that we don't get to that end point where I'm saying, hey, look, I hope we can slow this down, but I'm not sure if we can, but we're going to try. I'd rather be able to say, just do these four things every day, and I should see in another year, and everything should be the same, if not better.
Well, yeah, of course. And that's what we would hope for sure. I literally could talk to you for hours about this and hours and hours. And we're going to have to do another episode for sure. But I wanted to just say thank you again for joining me. And I'm really excited for what's to come. And the whole goal is to raise awareness. And I think we're in this together. You and I have talked about a million different ideas too that I think will have happen and all that fun stuff. But um, before we leave, I just want to put it out there. Where can people find you and learn more about what you're doing, and where they could even find you for, if they're in the GTA for an appointment with you as their dry eye specialist?
Yeah, yeah. So Instagram is usually the best way to find me. I'm dry.i.jedi, or Prism Dry Eye is another handle that our professional site. That's the best way to reach out to me, to be honest, and to find me. And so if you can reach out either of those two ways. And Angela, look, this is a wonderful platform that you're creating here. These
Mm,
conversations are certainly important, but more importantly, they seem very authentic. I've always told you that having a conversation with you,
mm,
whether it's on this screen or in person, is always the same. And I think that really resonates. So
mhm.
I applaud you, and I'm really thankful that you brought me out here to chat with your audience. And this is wonderful. I had a great time, and I hope it was
I'm
useful
so
for everyone too.
I think it absolutely. I think this is going to be the most listened to episode if I had to wager a guess. So, again, thank you. I'm so grateful for you joining us, and we'll definitely do this again. I'm looking forward to it.
Thanks for tuning in to Dry Eye Girlfriend, where beauty, wellness, and science come together to support your eyes and your life. If today's episode helped you feel seen, gave you that aha moment, or just made you feel a little more understood, share it with a friend, subscribe, and leave a review. It helps more women find this space and feel less alone on their dry eye journey. Remember, dry eye isn't just something to deal with, it's something you can manage with the right support, smart choices, and a little girlfriend guidance. I'll be back soon with more real talk, expert tips, and conversations that keep your eyes and spirit feeling bright. See you next time.